listeners. I would like to start by requesting you to introduce yourself so that our viewers can get to know you and your specialty.
Thank you, Mary. Good morning. I feel privileged to be in the show. My name is Dr. Wachira Murage. I'm obstetrician and gynecologist, and I'm also an infertility specialist.
Thank you, Daktari. So today we want to talk about antenatal health care and basically what services are supposed to be given to antenatal clients so that the outcomes can be good in terms of screening for early disease and prevention and such things, so that the mothers can be healthy throughout the pregnancy and also get healthy babies. So basically, Daktari, kindly highlight what we're supposed to do immediately someone realizes that they are pregnant.
Thank you, Mary. This is a very important health checkup for the pregnant mothers, because for a good antenatal care checkup has also very good outcomes. And as you know, pregnancy normally can have other problems. You can have things like diabetes coming up, things like hypertension coming up, and because the pregnancy changes the body. When it changes the body, then other things are about to come up. So it is with that you need good antenatal follow-up, checkups, so that you can have a healthy pregnancy and therefore a good, healthy, bouncing baby. So we like starting the antenatal checkups as early as possible. As soon as the mother realizes that they are pregnant, then they should come and see us. There are some few tests that we do. We want to screen them for a number of tests, and those are the tests that we normally combine them, and we call them antenatal profile tests. Those antenatal profile tests include HB. As you know, HB is a very important aspect of the baby well-being, because this is the HB both for the mother and the baby. The HB is the one that creates the oxygen. So we need the mother to have a good HB, normally 10 and above, because that will ensure that the mother will be able to transport oxygen to the baby. Also, remember pregnancy, the physiology, there is heavy load on the mother. So if they don't have a good HB, they will not be healthy, they will be panting, they will have swelling of the legs, they will have headaches, they will be feeling dizzy, and all those problems. So we need a good hemoglobin. The other test that we normally do is a blood group. For mothers who turn out blood group negative and their spouses are blood group positive, we have something special that we like doing, because sometimes you can have what is called Lisa's isoimmunization, that incompatibility, and that sometimes can lead to an abortion. It can lead to subsequent pregnancy losses. So for the mothers who turn out Lisa's negative, we like testing the fathers, and there's an injection we normally give at 28 weeks, and we also give another one at after birth within three days. So a blood group is very, very important. Again, remember, sometimes a mother can lose a lot of blood, so you already have an idea of the blood group. Then you are quickly able to sort out the problem and source for enough blood within a very, very short time. The other tests that we do are infections. We do hepatitis, we do syphilis, and we do HIV. These are very, very important tests because they have a direct effect on the baby. And if we are able to get them, we can treat them. For mothers who turn out HIV positive, it's no worry. We are getting very, very, very good results. Almost close to 100% of the babies are turning out negative, even with a HIV positive mother, because we have ways of dealing with that, and that's why we need to know early, so that we can start those mothers on treatment. We can advise them on breastfeeding, we can advise them on mode of delivery. So all those are important. Because things like syphilis has been eradicated, but we still get some one or two mothers once in a while who are positive, and we can treat the syphilis. For hepatitis, with an injection that we normally plan. All these things cost money, all these things are important, and we need to work with the mother to advise them. Like for hepatitis, it's an injection they get, an injection after birth. The baby is given those injections so that they do not get the hepatitis. The other test that we like doing is blood sugar. Blood sugar is very, very important because, as you know, diabetes has an effect on the baby and the mother. Very, very important because diabetes sometimes can kill the fetuses. Diabetes can lead to a big baby. Diabetes can lead to hypertension on the mother. Diabetes can reach high rates of cesarean section, difficult births. So there are all these problems associated with diabetes. But if you're able to get the diabetes test and you realize that the mother has gestational diabetes, then you can be able to treat and manage the diabetes. And that mother is going to have a safe pregnancy, safe delivery, and even a good baby. The other test that we normally do is urinalysis. Urinalysis is a simple test. It takes a very few minutes, but very, very informative. It normally tells us about infections. It will tell us about in case the mother is developing high blood pressure, what we call PET. It will tell us also if the mother is developing kidney diseases. It will tell us if the mother is about to develop diabetes. Okay, so it may look a simple test, but this is a very, very important test that we do. So we recommend in the first trimester, as early as possible. We also would want to know if the mother has low hemoglobin, then we can start them on treatment for that. If there is any other infections that have come up, we can start them early before they affect the baby. We also like doing an ultrasound early in pregnancy to be able to locate the location of the pregnancy, to be able even to know, is the pregnancy going well, is it viable, are there things like ovarian cysts, are there things like fibroids. So we like preparing the mother early. If they are overweight, if they are underweight, if they are vomiting, nausea, how do they correct all those? We also have a nutritionist here in Savannah Healthcare and a physiotherapist. So we want to prepare them. How active are they going to be? What are they going to eat? Yes, so all these things are important to start and planning because it's a journey. It's a journey that takes a long time. Those 9 months or 10 months, it's quite a journey, and especially for the first time mothers, for them to have to be comfortable and to have the knowledge, you want to start those checkups early. So the first trimester, that is what you do. As you know, you lay the foundation, you do the test, you do the scans. Come the second trimester, which runs from 14 to 28 weeks, then you like still following up. They are on supplements, the mother's on supplements, we are monitoring the weight, we are monitoring the growth. Then we do another ultrasound at 20 weeks. This is normally called an anomaly scan. An anomaly scan, normally what it does, it will check for the baby well-being. Are there some congenital problems? How is the head? How is the growth? How are the internal organs? How is the amount of fluid? That is an anomaly scan. And once you are happy, then we continue with the clinics. This is the time that is normally very exciting for the mothers because this is when they get the movements of the baby, the quickening. They're excited, at least they can feel alive inside themselves. It's called quickening. Normally occurs between 18 and 20 weeks. Then after 20 weeks, there's something else that we also like talking to the mothers about, and this is pre-eclampsia. It's abbreviated as PET. This is a condition that normally has become a major problem in the country and the world over. This is when there's a pregnancy-induced kind of hypertension. And this hypertension has far-reaching consequences on the mother and the baby. For the mother, the blood pressure can go up. They can get kidney failure. They can get even the heart is involved. Basically, even the eyes, all the organs in the body are affected. It also has an issue with the baby outcome because the problem with this pre-eclampsia, the pregnancy-induced hypertension, is that the placenta is the one that has a problem, and this placenta does not pass enough nutrients, enough blood, because it is defective to the baby, and therefore the growth of the baby is also affected. So we like signaling the mothers that if they get generalized body swelling, then they have very severe headaches. then we need to check their urine. And if we find some proteins in the urine, and we do a blood pressure and we get 140 over 90 and above, then with all those, then we can make a diagnosis of pre-eclampsia. You are able to manage it early, you are able to work with the mother and be able to control that pressure and be able to push until the baby is viable, and then we can deliver. So that is very important from 20 weeks onwards till delivery. And this pre-eclampsia can also come as postpartum. After they have delivered, they can still have this pressure. So we work with them and advise them. So now, third trimester starts from 28 weeks, and basically this is now when we are now thinking of delivery. What are the options of delivery? What are the hospitals? How can you access delivery in terms of costs, in terms of are you going to go for packages, are you going to have private doctor, and advise you on how you're going to deliver. We also now institute Lamas classes. We have Lamas classes in Savannah Healthcare, where now this is normally a couple session. We tell them to come from around 26 onwards, and this is the time now we teach the mothers plus the husbands what do you expect in pregnancy? How will you behave during labor? What is the kind of support that as a husband, as a companion, can you give your wife? To help them? Can you give your sister? Can you give your cousin? Can you give the pregnant mother? How do we take care of them? And when the baby comes, how do we take care of the baby? How shall we even shower the baby? What are the symptoms that can tell us? All those things are discussed with these Lamas sessions. Very, very important. We continually advise the mothers on the danger signs. We have a good antenatal card that summarizes the danger signs, that we keep revising them. Because issues in pregnancy don't just come. Sometimes they have some signaling signs. And if a mother does not know about those signaling signs, if a mother is not aware, then they just get things when they have turned out very bad and very little can be done, and normally the outcome it's normally very bad. So we have summarized those danger signs. Among them is bleeding, when they have pain, when they have generalized body swelling, when they have some headaches, even when they get blurred vision. Those are times, those are signs that can tell us something is about to happen, and this is what it can do. Movements of the baby. We encourage the mothers, as soon as the movements start coming, can they acclimatize with the movements? Because we really depend on the mother for the movements of the baby. When they tell us the movements are reduced, we track, because probably at that point maybe the cord is becoming tight on the neck, maybe the placenta is having a problem, maybe the baby is unwell, so the movements kind of reduce. And that is the time sometimes we consider delivering the baby as an emergency. That can save, because some mothers who come and they say the baby has been kicking slowly since yesterday. By the time they are arriving in the clinic, the baby is no more. So we like talking about those danger signs to the mothers and explaining to them so that they are aware of them. Come third trimester is the final trimester that goes up to 40 weeks. Time for preparation for delivery. We tell them about what are the things that can bring cesarean sections, things like poor progress of labor, things like fetal distress, which is the commonest, and many other things that we bring. What are the expectations? What do you expect in labor? What will you do when the signs of labor come? We tell them about the signs of labor, which are recurrent pelvic, recurrent abdominal pains. You can have the show, that is the bloody discharge, or you can have the drainage. So you tell them, if you find these signs, just call the doctor, call me, tell me I'm at home and I want to go to the hospital because I'm getting this. And once you get to the hospital, you are checked, and then I'm informed, and then we start the process of labor. So we educate, and this is the importance of these checkups and the frequent attending the antenatal clinics. We recommend in the first trimester every month. In the second trimester, you can come twice per month, and then after that every 2 weeks, and then the last 38 weeks you come every week. So we program them in such a way that we are not missing anything, and you feel that as gynecologists in Savannah Healthcare, we are close to you in terms of those follow-ups. come the delivery, then after the delivery, after the mother you have had the baby, then you have the postnatal checkups, which are normally after 2 weeks. You just see how you're doing, how is the breastfeeding, have you lost weight, how is the baby doing, and then after that we have another 1 month where now we institute the family planning options. We'll have discussed them on the 2nd week visit, so that we can institute it on the 1 month visit. And that is the time now we do pap smear, we institute the family planning method, and then we can allow the mother now to go and breastfeed the child, join the family now, and integrate into the community to take care of the baby. But every 2 years we recommend that the mother should see us, so that we can have the checkups, the pap smears especially, and other checkups, so that we ensure the mother remains healthy for their next baby. Thank you.
Thank you. That was very elaborative. So just as we conclude, Dr. you can mention clearly so that our expectant mothers can understand what is the danger period, or rather when do we say you're out of danger after delivery?
There's this period called preparing, the 6 weeks period. This is when the body is still pregnant. Yes, the baby is already born, but you still have those pregnancy hormones. And the pressure can come then, diabetes can come then, even the eclampsia, the worst of the pregnancy, this where the mothers can get fits, can also come. So within those 6 weeks, the mother is still pregnant, and therefore there is a possible danger. And that is why you want to see them after 2 weeks. Then you see them at the end of that preparium to ensure that the pregnancy-related complications cannot come. Also, something that we fear a lot is clot formation in the legs, which can come to the chest. It's called deep venous thrombosis, or DVT. And that is why we recommend the mothers to be active and to move around to ensure that they do not get that. So the preparium, at the end of the preparium, that's when we consider that the mother is out of danger of pregnancy-related complications.
So thank you for that, Dr. It was a very elaborative discussion. So as we conclude, we want to welcome our viewers to Savannah Healthcare Services. We have a gynecologist, obstetrician every day, Monday to Saturday, from about 10 a.m. up to around 7 p.m. So we welcome you all for that experience, because as we have heard Dr. elaborate, it means we have doctors who are ready to walk the journey of pregnancy with you right from trimester 1 until you deliver.